Good evening, guys. I have C for you. So now we're discussing expanded guide 5 key facts retirees must know about nursing homes. Okay, so here we go. This page serves as a practical, reality-based guide for retirees and their families navigating the complex world of nursing home care. It's not just about choosing a facility, it's about understanding the system, anticipating costs, and making informed decisions that align with health needs, financial realities, and long term goals. What nursing homes really offer. Nursing homes, also known as skilled nursing facilities, are more than places for end of life care. They provide 24/7 medical on site oversight for chronic conditions, post surgical recovery, and mobility issues. Personal care services like bathing, dressing, and medication management. Rehabilitation programs, including physical, occupational, and speech therapy. Long-term custodial care for residents with progressive conditions such as Alzheimer's or Parkinson's. Understanding the distinction between short-term rehab and long-term residency is crucial. Some facilities specialize in transitional care after hospitalization, while others are equipped for ongoing supports. Then you have to consider costs and payment structures. Okay, here we go with those. Nursing home care is one of the most expensive forms of elder care, often exceeding 100,000 annually for long-term care stays. Payment typically involves Medicare covers short-term rehab after hospitalization, but not long-term custodial care. Medicaid, the primary payer for long-term care, but eligibility requires meeting income and asset thresholds. Private pay, many residents pay out of pocket until they qualify for Medicaid. Long-term care insurance can offset costs, but policies vary widely in coverage. Policy changes, especially to Medicaid, can dramatically affect access, affordability, and facility quality. Retirees should stay informed about state level Medicaid waivers and federal funding shifts. Quality and staffing are critical. Not all nursing homes are created equal. Key indicators of quality include staffing ratios. More staff per resident generally means better care. Inspection records. Look for patterns of violations or deficiencies. Resident outcomes. Facilities with higher staffing and better funding tend to have fewer hospital readmissions and better health matrix. Facilities heavily reliant on Medicaid may struggle with staffing due to lower reimbursement rates. This can lead to burnout, turnover, and compromised care. Choosing the right facility requires research. Proximity and reputation aren't enough. Retirees and families should tour multiple facilities and observe staff interactions, cleanliness, and resident engagement. Review inspection reports and complaint histories via state health departments or Medicaid's nursing home compared to ask about clinical specialties, especially for conditions like dementia, stroke recovery, or diabetes. Evaluate transition supports for returning home or moving to assisted living. A good fit depends on both medical needs and personal preferences. Some facilities offer robust social programming, others focus on clinical excellence. Nursing homes serve diverse needs. Nursing homes aren't just for permanent placement. Many retirees use them for temporarily after surgery, injury, or illness, intermittently for respite care when caregivers need a break, long term care when conditions like dementia or frailty make independent living unsafe, matching the facility's capabilities to the resident's evolving needs is essential. For example, a person with mild cognitive impairment may thrive in a facility with memory care. Programming, while someone recovering from hip fracture may need intensive physical therapy, when when retirees should what retirees should do next. Compare attributes. Look at clinical services, staff ratios, inspections, inspection, uh, citations, payment options, and transition supports. Monitor policy changes. Stay alert to shifts in Medicaid eligibility, reimbursement rates, and federal oversight that could impact care access. The final takeaway, guys, is in my own personal words. If you put your family member in a facility, visit often. Make sure that they're getting the kind of care you signed them in for. And if they're not, be their voice when they can't. You have to. You have to voice your concerns when you go visit. If you see something out of place, say something. Don't let it sit too long for them not to address it. You have to address it right then and there. You have to make sure that the care is actually up to par. You have to make sure they care about your person that you put in there also, and that your family member is comfortable. Don't just go put Aunt Sally in the facility because she needs the support. Make sure she fits. Make sure that fits her needs. That matters. And that she's happy there. You have to make sure she fits in and that she makes it, you know, because it's their home. It's someone's home when they have to give up where they're living or for medical reasons. But you have to make sure that they're happy with the placement. You have to make sure that things are being taken care of. You have to be there to make sure that things are run every day. Stop in the evening, throughout the day. Make sure somebody's always there to make sure that care is done right. Okay, here's the takeaway that I'm going to add. This guide empowers retirees with actionable insights. Understand the types of care available, how payment works, what quality looks like, how to evaluate facilities, and when short term versus long term placement makes sense. It's about making choices that preserve dignity, autonomy, and well being, whether for a brief recovery or a longer journey. Okay, guys, so that is C for you. I will be back on shortly with D. Give me a bit for D, please, and I'll be back on with that for you. Okay? For now, Gator Wellness, take care, folks.